the resources that are available in the community for people at home. I know that a lot of people are unaware of the different resources that allow them to continue to live safely and with a better quality of life at home. And I'm with AGrace Hospice. We have hospice, palliative care, and also non-medical home care. So I'll be talking about what is entailed with all of these services and how they can assist people in their home. So first, some information about AGrace. So AGrace is a local nonprofit community-supported organization that was started in 1978. So we have been your hometown hospice and community organization for over 50 years. We're currently serving over 18 Wisconsin counties, and we originally started out as just a small group of volunteers in the basement of a church that wanted to be able to support their community members at end of life with hospice. And we have grown over those years to become a much larger organization. As I said, we're now serving over 18 counties in Wisconsin, and we have offices in Madison, in Janesville, Baraboo, and Platteville. We have over 900 patients that we take care of every day in their home, and we have over 900 volunteers in the community. So we are so lucky that we are so well supported by our community in being able to complete our mission. As an organization that's been in the community for such a long period of time, we work with all the physician groups, clinics, and hospitals in the area. And we also have a special affiliation and partnership with UW Health and Unity Point Meriter. One of the great things about AGrace is because we're so well integrated into the community, we also are lucky enough to be sponsored through the UW on their Epic system. So we have the option to be able to access patient information for our patients, for the hospital, and also the clinic. So it really helps with integration of care and collaboration with our local physicians. So with COVID-19, AGrace has implemented additional precautions for patient safety. The safety of our patients and family members of our utmost importance, as well as our own employees. So since COVID-19 has come into our community, we have started some different protocols for patient safety. The first one is staff screening and illness. We are having each of our employees self-monitor for symptoms at least twice a day. Before any of our employees are able to come to work, they have to self-report any symptoms that they are having in an app. And obviously, if somebody is having any COVID-19 type symptoms, they would not be able to come to work. The other thing that we're doing to make sure that our patients and also our employees are safe is we are also requiring PPE. So every single one of our employees that works with patients at a minimum is wearing a face shield and a surgical mask on every patient visit. And then we can also use an N95 and a face shield depending on the patient. We also have visitor screening, so we are allowing visitors to see our patients at the AGrace inpatient unit, residence, and hospice care suites, but we are asking, we are having each of our visitors screened for COVID-19 symptoms at the AGrace entrance, and we are also asking them to bring a cloth face mask to wear during that visit. We will also have face masks available at the front desk as well if someone does not have one. Due to COVID-19, it has changed some of our practices, but what we're doing is we're still offering all of our full services for hospice, palliative care, and age at home. What we're doing is we're just being flexible with that. We've implemented telemedicine, so for those visits that can be done during doing telemedicine, or if that's the preference of the patient or the family due to concerns about COVID, we can do that as well. So we have just tried to be really flexible to what our patients' needs are during this changing environment. So we get asked a lot, what is hospice care? And hospice care is a blend of medical, emotional, and spiritual care. The philosophy of hospice is we really look at the full person. So we understand that, it's not just what somebody's diagnosis is, having, being end of life, having a serious illness really impacts that person. So we want to be able to support them in all aspects of their life. So for people of any age, a lot of times people ask, like, how would somebody be eligible for hospice? And what we say is you need to have 2 physicians say that they wouldn't be surprised with somebody's life-limiting illness, that they would potentially die within 6 months. And they also have to have a primary goal of they just want to be comfortable and symptom-free and aren't looking to do curative therapy any longer. One of the questions that I get asked a lot is, well, at 6 months, like, does that mean that then, my mom or dad wouldn't be able to be on hospice anymore? And again, it's just ongoing. If 2 physicians continue to say that somebody meets that criteria for hospice, a person can continue to be on hospice for longer. Sometimes we've had people on hospice much longer than 6 months. Sometimes what we even have too is that somebody's been going through, a lot of decline, but with that additional one-on-one support of hospice, they actually start feeling so much better that they actually don't meet that criteria for hospice any longer, and they do what we call graduate. So that means that they would no longer be on hospice, but in any time in the future, if that person would continue to show some additional decline, they could always re-enroll onto services. So what we always say, it's never too early to call AGrace, just because you can get that additional, one-on-one support, additional support right in the home, and that can be really beneficial for someone. So a lot of people also ask, where do I have to go to get hospice? And they don't realize that care actually comes to you wherever you call home. So that could be, maybe in a private residence, it could be an apartment, it could be a condo, it could be a nursing home, assisted living, independent living apartment place, really anywhere. It could even be a hotel. We come to wherever someone comes home. And I think that's really important because a lot of people are feeling most comfortable at home and want to be able to have an option to be able to stay at home for as long as they can. And AGrace can oftentimes be that additional resource that can allow that person to meet their goals. So when should somebody call AGrace? So here's just some health decline signs that are very common that would say if you're starting to notice some of these changes with your loved one, it'd be a good idea to call AGrace and see if you can get some extra assistance. So it might be, that you've noticed that your loved one is starting to lose weight and you're not really sure why. All of a sudden their clothes just, are getting more baggy. Someone's looking maybe a little more fragile. It could be that someone has more shortness of breath. You're noticing that they really are starting to get exhausted, even when they're maybe just going for a short walk. It could be that, you've noticed that someone is having more ER visits or hospitalizations. It seems like that's becoming more and more frequent. It could be that someone's suddenly starting to fall or falling more frequently than they ever used to. It could be that just someone has less appetite. They just don't seem that interested in food. They might even have some difficulty with swallowing. And you've noticed that they really just seem really more fatigued. They're sleeping more, they have weakness, they seem to have like a lack of energy. And that's a change for them. It could also be that they're, really starting to have like uncontrolled pain or other symptoms. Could be multiple, skin sores that don't heal. They're starting to have some wounds. And then you're noticing those activities of daily living, eating, grooming, skincare, bathing, that person is starting to have, more difficulties. These would all be reasons, to give AGrace a call and just see, can you get an extra level of support, in the home for your loved one? So what does hospice provide? Hospice provides a lot of comprehensive, support in the home for the person. There would be home visits from your AGrace care team. One of the things that, I've heard so much, from our families is they just really appreciate the fact that you have a nurse, an RN, that can come right out to the home. So if you have the need for an assessment, maybe it's a situation where somebody had a fall and in the past they would have had to go out to the emergency room or the hospital. But the nice thing about having AGrace on board is that the nurse after a fall can come right out to you in the home and be able to do that assessment at home and then determine, if somebody needs to go anywhere. Also, you get medical care. Any medicines that are associated with a primary diagnosis for hospice are covered. Medical and equipment and supplies. It's great to be able to have durable medical equipment through AGrace, and that would be things like a walker, a wheelchair, an over-the-bed table, a hospital bed, a shower chair. All those things would be supplied by AGrace and just taken right out to the home. Also, incontinence supplies are also covered through AGrace and would be able to be coming right out to the home. We also will be able to help manage those pain and other symptoms. As someone is progressing through end of life, they oftentimes start having more symptoms, and pain management is important. And that's something where you're getting that specialized care from an expert in hospice. We also, we talked about, it's not just, the diagnosis and the symptoms, but it's the whole person that we're supporting. And so that's why we also are going to be offering grief and spiritual support, but it's not just for the patient, it's also for the family and the loved ones. And that's also ongoing. We actually follow our families for a year after the patient's passing, so they get the additional support that they need. Also, too, we have the option that if somebody would need to go to the hospital, we have short-term inpatient care, and that's right at our AGrace inpatient units. We also know that there's only one opportunity, for this to be a good experience for someone. So we also want to be able to offer education on what to expect so that there's no surprises along the way, and we can make sure that people's wishes are being followed. If there's education that's needed for family and caregivers that are taking care of that loved one at home, we can also provide education as well so that they can take care of their loved one. And then we also understand that sometimes it can be a lot for somebody who's living at home as a caregiver. So we also can arrange for respite care so that that caregiver can have a break as well. So we call our hospice team the circle of care, and the reason for that is because we have so many people that are going to be there to be able to support our patient on hospice and also their family and loved ones. So, so we have a registered nurse. That person is going to be in charge of the care plan for the patient, and will work with the patient and also their family on what their wishes are so that they can be best taken care of. We also have a social worker who's there to support not only the patient but the family. They can connect the family and patient with additional resources and can also be a form of wonderful support. We also have our awesome certified nursing assistants. These are CNAs that will come right out to the home, and they'll do things like assisting with bathing and dressing and helping somebody to get up. So they can help with some of those activities of daily living. It might be feeding someone as well. So they're an extra level of support to help someone who's at home. We also have a hospice doctor, a nurse practitioner that's overseeing care, but I want to make sure that everyone is aware that, that the primary physician that we're still going to be working with is going to be your primary care physician. So we do not take over that care. We will be working with your primary care physician on your care plan. And I think that's important because I know there's a strong relationship between our patients and their doctors, and we want to be a part of that. We don't want to replace that. We also have a spiritual and grief counselor that can provide some additional support. We will also, if there is a strong faith community that a patient is already working with, we are very well integrated into the local churches and faith communities, and we'd be happy to have our spiritual and grief counselor, work with your local faith community as well. And then right now, normally we have all of our wonderful volunteers from AGrace that can come out and do companionship visits. Due to COVID-19, we do have our volunteers currently on hold, but what we are doing instead is if there's a need for a volunteer visit, we're still working with our CNAs, and we can have our CNAs redeployed out as a volunteer to do companionship in the home as well. We have interpreter services that are available if English is not someone's primary language. And of course, the circle of care wouldn't be complete about family and friends, your personal physician. And then if someone is living in a long-term care community, assisted living, nursing home, we also, of course, work very closely with the professional caregivers or the facility staff at that community as well. So there's a whole group of people that are really there to be able to support someone on their end of life journey. So a lot of people wonder, how is hospice paid for? And I know that's always like a big question and concern. And the great thing in this country is that, people understand how important end-of-life care is. And so in the United States, we have what we call the hospice Medicare benefit. So this means that, as soon as somebody turns 65, they automatically have their hospice covered through the hospice Medicare benefit. So that means that, that the majority of our patients, have their hospice paid for through that. Hospice can also be covered through Medicaid and also through private insurance. And because AGrace is a local nonprofit community supported organization, we also offer what we call AGrace Care for All. So that is our charity care program. So that's if somebody is unable to pay for hospice or palliative care. Say, for example, maybe they aren't age 65 yet, so they don't qualify yet for Medicare. They can always put a application in for financial need through AGrace Care for All, and that will pay for all or part of their hospice expenses. So there is very little out-of-pocket cost. There's not going to be any sort of bills that anybody gets through Medicare. So, what we look at is, please, we want people to know that this is something that's covered through Medicare, because we don't want people to not be able to take full advantage of this benefit. And a lot of times what I hear from many family members is they just say, I really wish that I would have known about hospice sooner, and I wish that my loved one would have been on hospice earlier, because they're so grateful for the additional support that they have for their loved one. One of the other things, that we offer at AGrace too, is inpatient hospice care. So this would be, say, for example, that someone needs to go to the hospital. Well, if they're on hospice with AGrace, they have the option of being able to come to the AGrace inpatient unit. Again, it's just like a hospital. It would be for acute symptom management. Say, for example, somebody's having a pain crisis, and we want to be able to titrate medications, to be able to get that under control. Or somebody is really having terrible difficulty breathing, which can be very frightening. They have the option to be able to come here as well. So it would be an option, just like going to the hospital. As soon as we can get these acute symptoms under control, what we will do is then we will discharge that person, back home again. So it's just meant for short stays, usually on average about 5 days, and it's covered by Medicare. We also have the option with AGrace for residential care. We do have some patients, while the majority of them, they will end up staying, at home. We have about only 5% of our patients out of the 900 we talked about earlier will ever come to any of the AGrace buildings. The majority of them will just stay comfortable at home. But sometimes we do have some patients that just want to be able to come live at AGrace. And so that would be where they would come for residential care. We do have hospice staff that are there around the clock, 24/7. And so while your hospice care would be covered by Medicare, or like we talked about Medicaid or private insurance, this would just be the same thing as going to live in assisted living. So that is not covered through Medicare. So family or the patient would be paying for that. The room and board associated with it. The other thing that we just added to in the last year is people were interested in having an option for memory care for hospice patients. So we did just open 12 beds, and it's a new hospice memory care suites last year. We have Dr. Ken Robbins, who's a noted geriatric psychiatrist. He is overseeing the patients there. And so that's another option for people as well on AGrace. So, so the cost for per day for the residents is $365 a day, and the cost per day for the memory care suites is $385 per day. And here's a picture of what the Madison inpatient unit and residence looks like. There are 50 beds total, and this is located in Fitchburg. And then we also have our Janesville inpatient unit and residence, and this would just be 12 beds. So, you know, with hospice, you know, really what we're looking at is, you know, being able to support the full person, just mentally, physically, emotionally, being able to have like a whole team of people. And I think that, you know, sometimes it can be really frightening for someone, you know, because they think that, you know, if they go on hospice, that means that they really only have, you know, maybe just days or weeks left. And like we've talked about before, you know, people can be on hospice for 6 months and sometimes even longer. So, you know, so what's really important is we want to make sure that somebody's wishes, you know, are being recognized and also respected. And that's really what hospice is everyone's hospice experience is according to what that patient wants. So we're going to be asking you, what's most important to you? What do you want to be able to achieve, you know, with the time that you have? How can we support you on this journey, you and your family? And so everyone's journey is going to be different because, you know, what I might want and what another person might want is very different, but we just want to make sure that that's being granted, that's being respected, and if we can fulfill all that so that somebody has a good journey, because there's only one opportunity to do this right, and we want to make sure that somebody's journey is as good as it can get. I know too that, you know, people might be concerned about, you know, well, I don't know that I want, you know, a lot of people in my home right now with everything going on. And, you know, we're being respectful of that, you know, whatever somebody wants as far as, you know, being able to kind of choose from the number of people that are coming in. We respect that. And we also talked about like telemedicine. That's one thing that we've been able to do so that we can get someone the support and the resources that they need, but it may not always be in a face-to-face visit if that's not what somebody is wanting on a regular basis. So, so we're really just being flexible, but we do want to make sure that people are just aware that this benefit is out there, and that we just want to be able to support people wherever they are. So what if hospice isn't right for me? So I'm going to be talking about another service that we have, which is Pallia Health by AGrace. And Pallia Health was really started because the year before we started palliative care, we got 500 phone calls, and you know, it was people calling because, you know, they wanted a hospice assessment and they needed assistance, but they weren't necessarily meeting that criteria that we talked about for hospice. But it didn't mean that they didn't still need assistance. So we really felt like there was a need for a service that could help increase someone's quality of life help someone with symptoms and pain management before they would necessarily need hospice. So that's really what palliative care is for. So it's supportive care during serious illness. Is available at any point in the illness, and you can also be getting curative treatment, because we had a lot of people that said, you know, I still want to continue on with my curative treatment. Maybe it's, you know, surgeries, maybe it's radiation or chemotherapy or dialysis, but I'm really still struggling with my illness and I could really use some additional assistance with that. And so that's really what palliative care can be. People can continue to be doing rehab, OT, PT at the same time. So that's something that, you know, that we can continue to help them with their chronic illness while they're getting that curative therapy. But just like hospice, the focus is really on that quality of life. So it's looking at that hospice philosophy of the full person. So it's, you know, mentally, physically, emotionally, socially, how can that person get supported and really help them with that serious illness? Because we understand having a chronic illness is very stressful, not only on the patient, but also the caregiver and family members. So what can we do to support everyone? And this is also covered by Medicare Part B. So, so with Medicare Part B, typically if you're going to your doctor and you're getting a small copay when you go, you will typically have a small copay with palliative care as well. What we will do is we can take the information for the referral. We'll let the patient know ahead of time exactly how it's going to be paid for, so there isn't any surprises. So if there's a small copay, then the patient will know before we send out the provider. So who can be helped with palliative care? So it's really anyone who has any sort of serious or chronic illness. We see a lot of patients that have dementia and Alzheimer's. Oftentimes it might be somebody who's been noticing that they're starting to see some changes, some decline with their memory, and they want to be able to kind of just sit down and let's talk about a care plan, a plan going forward, you know, for how I want to deal with this. We do a lot of advanced care planning during our palliative care sessions, and we hear from our patients and family members it's extremely valuable. We also can help people with, you know, CHF, congestive heart failure, COPD, and other heart, liver, kidney, or lung diseases. We have patients with cancer, patients with MS, ALS, or Parkinson's, people that have had strokes, HIV or AIDS, lupus, other more rare illnesses. We also see a lot of people that are suffering from depression, anxiety, mental health. We also have a geriatric psychiatrist that can also come out through this program. So it's really any sort of chronic condition where someone is experiencing symptoms and or pain. And it's really all about that symptom management. How can we get somebody to be living more successfully with a better quality of life with this illness? Because we understand, you know, and oftentimes you're not going to be able to cure these chronic illnesses, but how can we help someone live more successfully with them? So what is a Pallia Health consultation? So this program is really a consult service. So we are not going to be taking over care from your primary care physician, but just like how you would be going to, say, a cardiologist if you have a heart condition, it's a, you know, heart specialist. Palliative care is going to a palliative specialist, you know, to help see if there's ways to be able to live more successfully with this disease, because palliative care is all about comfort and symptom management. So what we do is we send out either a nurse practitioner or a physician right to the home. And it's really an opportunity for them to be able to spend some time with the patient and really come up with a good plan moving forward. So we have the luxury, because we're a consult service, that we can spend up to 2 hours on the very first visit with the patient, and then also if they have a caregiver there too, and really get to know them, ask a lot of questions, be able to find out, you know, tell me how you're living, you know, with this, you know, chronic condition. What symptoms are you having? What, you know, challenges are you having? What's important to you? You know, what would be like the main thing you know, you'd really like to see, you know, better with your health? Being able to also review do a full medication review of all the medications that you're taking, talk about what your goals are, what your challenges are, and then just really put a plan together to get recommendations about, medications, lifestyle changes, other treatment therapy. We also have a social worker with this program, so we can connect with any additional community resources that might be able to make life a lot easier. Oftentimes, once you have that initial consultation, it might be that maybe it makes all the difference, just to be able to make some medication changes. Maybe there is some medications that were interacting that have been prescribed by different physicians. And so there are some different choices, better choices. It could also mean maybe, having a non-medical home care caregiver coming in to assist during the week as well. Different things that can help with quality of life. And then, depending on each person's visit and what's needed, we can do follow-up visits if medically necessary. So it really depends on whatever is needed for that individual patient. If there's really a complex situation going on and there's the need for additional visits, maybe the nurse practitioner will come out monthly. Otherwise, maybe after a couple of visits, we're really able to come to where the symptoms are being managed at this point, and there wouldn't be the need for another visit for a while. So really the goals of Pallia Health is to address those poorly controlled symptoms. We want to be able to prevent, relieve suffering. We want to maximize someone's comfort and safety, improve someone's function, especially their independence, their ability to be able to still live at home, and support a better quality of life for that patient and also for their family. So Age at Home is the other service that we have at AGrace, and this is our newest service, and this is non-medical home care. So so really the goal is for people to be able to remain safe and independent at home. So this is not covered by Medicare at all or Medicaid. It's paid for out of pocket, and any revenue from Age at Home is just reinvested back into AGrace's nonprofit hospice services. So what a lot of people have liked about Age at Home is that, you can have a caregiver come right out to the home and help with things like personal care. So maybe it's like bathing or getting dressed or toileting. There's also meal preparation. We've had some of our clients that, maybe they've lost a spouse. And so, but there is a favorite meal that their wife used to always prepare for them. So that's something that, that we can do using those recipes. Could be reminders to take medication, do some light housekeeping, throw some laundry in, help with bathing, grooming, dressing. Transportation as well has been really big. I know sometimes people are very independent, but maybe they just don't drive anymore. So it'd be great to be able to have someone that could take them, to do errands or go to church, go visit a friend. They just need that transportation. We talked about errands like grocery shopping. So there's a number of different things that Age at Home can assist with their caregivers, and just another way to help someone to be able to function better and stay independent longer at home. AGrace also offers grief support. Since we are a community funded and supported organization, we are lucky enough to have a wonderful foundation that has been willing to fund the AGrace Grief Support Center. So this is a freestanding location. It's just for grief support. It's not attached to our AGrace inpatient unit in Fitchburg. It's a couple miles away. The feedback we've gotten is that for some people, it's very difficult for them to go back to AGrace if they've had a loved one at the inpatient unit. So we wanted to have a safe space where people could come for their grief services. So, so we have, this center is for adults, and because of the additional space now in the grief center, we also have our adult and children grief groups. So we can have teens and school-age children come here as well for grief support. So we're doing support groups. We also have the option for people that maybe support groups are not the best choice for them. They like that one-on-one support, so we can also do one-on-one grief support. And then we also have a number of rooms here at the Grief Center where we can do therapeutic play or art activities with the children as well. And this is open to the community. So this is for anyone in the community. You do not have to have had a loved one on AGrace to be able to participate in this. So right now during COVID-19, we do have some groups that are virtual. We are doing some small groups, again, in person, and we're offering the option for our one-on-one. If you want to do it virtually or over the phone, you can do that, or we can also meet there at the Grief Center as well. So we're trying to be very flexible with the options as well while being safe. So that's the teen room, and then we also have our dramatic playroom here as well. So any questions at all on the services that we've talked about with AGrace?